Hello, welcome. This video talks through a shoulder polysling, its indications for use, how to apply it and remove it safely, and also some information regarding practical application which may make life a little bit easier for you. The shoulder polysling gets its name from the fact that it can be used for different applications and comprises of more than one piece. This polysling is used commonly after shoulder trauma or often complex surgery where immobilization and protection is desired. It's always useful to understand how your sling works and its components. The first main part of the sling is the shoulder strap, comprised with the main arm support. Number two is the extra body strap, which may be used optionally in some cases. And number three is a small strap which closes the sling at the forearm. These can be seen in these pictures here. So let's run through the initial fitting of your shoulder polysling, and this is usually performed by a physiotherapist or any health professional competent and trained to do so. So the initial fitting of the sling is quite straightforward. The forearm is placed into the sling, as can be seen, with the elbow pushed back as far as possible, and this ensures that the hand is free to be used if necessary. Then the sling is closed together at the wrist area, and this is with a small Velcro piece with the white plastic D-ring, which can be seen held at the moment in the picture. And then finally the sling is closed with a small second Velcro strap near the elbow. And the final part of the fitting is taking the strap from the elbow and the back of the shoulder all the way around and down, and this goes through the white plastic D-ring which is attached to the small Velcro strap at the wrist we fitted earlier. Once this goes through the D-ring, it comes back on itself and attaches to the strap with the Velcro near the neck area. The forearm should be across the body in most cases and the elbow at approximately 90 degrees. Some patients may be fitted with an additional body strap, and this is a strap going round the waist, really to immobilise the shoulder more thoroughly. This is useful following complex shoulder trauma or surgery. This body strap is attached via Velcro at the elbow, all the way around the waist, and it is pushed through the second plastic D-ring on the inside of the wrist. It's pulled back on itself, and this attaches onto the strap itself with Velcro. And this allows quite firm immobilisation. It really pulls the arm and elbow into the waist. This may not be fitted in your case, and if it is usually able to be removed for washing and dressing with care. So once your sling's been fitted initially, you're going to want to remove it fairly often during the day for washing, dressing, and also perhaps to take the pressure off your neck while sitting in a chair, and this can be done by supporting your arm on a pillow. You may also want to remove your sling to perform your physiotherapy exercises, which may have been advised before you either leave hospital or by your physiotherapist at your last appointment. So it can be done quite simply by removing the Velcro straps or just undoing them as this video shows. Simply popping your hand inside the strap, removing the sling up and over your neck, and make sure this is done with your arm supported on a pillow. And to reapply the sling, pretty much the opposite of putting it on, just offer up the sling to the arm, pop the shoulder strap over the neck, ensure that the elbow is pushed to the very back of the sling. It's just simply a case of reattaching the Velcro straps near the elbow and at the wrist. So a few final things to remember while washing this sling. Ensure to do this via hand. If you machine wash a polysling, it will affect the Velcro's effectiveness. It's probably also wise to avoid using a tumble dryer for the same reasons, not to bleach or iron the sling, and also to avoid putting on a radiator because the plastic rings may heat up and cause burns. Many thanks for watching, and just remember, if you have any problems reapplying or applying your sling, please make sure you speak to a health professional, preferably the same person who fitted the sling in the first place.